Many patients ask me if they should check for HPV, and if they have the vaccination, what they should expect, and if they come positive HPV, what they should do. So the vaccination is only against 6 strain of HPV. So it's actually quite common for my patients to have the vaccine but still come up with a HPV positive. Number one, it could be one of the strains that they are not vaccinated against, or sometimes the vaccine is 100%, so you can still have the HPV, or they could have been exposed to it before the vaccination. Regardless, I don't recommend routine HPV tests for all the patients. Usually it's based on risk factor and depend on a pap smear. If the pap smear is normal, we just have to follow on a regular basis. If the pap smear is abnormal, something called ASCUS level, ASCUS, they definitely need a HPV test. And if the HPV is positive, they need a biopsy. And if the pap smear is more than that, like a low grade or high grade, they need a biopsy for sure, something called colposcopy. Sometimes we do HPV test on the patients, and if it's positive, regardless of pap smear, even if it's normal, we do recommend to do a biopsy to make sure there is no abnormal cells involved. But you should know that HPV is very common, and as CDC explains, almost everybody at some point during their life who are sexually active get exposed to HPV. So it's very common, and I want my patient to know that just because I'm HPV positive doesn't mean that it's necessarily going to do something to them or their cancer, but they need a closer follow-up, and that's it.